Welcome to the Johns Hopkins Women's Health Podcast, A Woman's Journey, Insights That Matter. I'm Kelly Gear-Ripken, and I invite you to listen to Johns Hopkins specialists discuss the latest topics in women's health. Now here's your host, Lillie Shockney.
Hi, this is Lillie Shockney from A Woman's Journey at Johns Hopkins, and this is our podcast, Insights That Matter. In this podcast, I am joined by Dr. Alexander Pantelyat, an assistant professor of neurology, who also serves as the director of the Atypical Parkinson Center at Johns Hopkins, and is the co-founder and director of the Johns Hopkins Center for Music and Medicine. Today, we are discussing the potential role music can play within medicine to help heal and prevent some neurodegenerative diseases. So welcome, Alex, and thanks so much for joining me today.
Thank you so much. It's a pleasure to be here.
Let's start off with what are the major neurodegenerative diseases and how many people in the United States are affected by these diseases?
The most common neurodegenerative disease that everyone has heard about, I'm sure, is Alzheimer's disease. It affects at least 6 million Americans by current estimates. And what it really means is that it affects at least 3 to 4 times as many people in the way of care partners, spouses, adult children, people who are close to these patients who are suffering from Alzheimer's disease. The second most common neurodegenerative disease is Parkinson's disease, and that affects between 1 and 1.5 million people. Also, of course, very common. And again, the same applies. It affects at least 3 times as many people as that in reality because of care partners, family members, loved ones who are suffering alongside these patients.
Are these statistics based on those that have been actually diagnosed, or does it also include a guesstimation of those that have not yet been diagnosed? Because we know that just like with the world of cancer that I live in professionally, there's lots of people that have cancer and they don't know it. And so they don't end up in a database to be statistically counted. So when we say X number of people have been diagnosed with this particular cancer, so I'm wondering, does the same apply for both of these neurological disorders?
I think you're 100% right. We suspect that many people are living with, some people say, a precondition or preclinical stage of Alzheimer's disease and Parkinson's disease. So the estimates are absolutely flawed. They're underestimates. The other thing to note is that it's challenging to diagnose these conditions because unlike in cancer, where for so many types of cancer, there are blood tests, there are biopsies available that have been developed, we are really about 15 years behind by most estimates behind where cancer is, both in terms of accurate objective diagnosis and treatment, precision-based treatment that depends on genetic testing and other advanced testing to precisely pinpoint where the problem in the neurodegenerative disorder lies. But that means that the next 15 to 20 years have a lot of promise, and there's a lot of excitement in neuroscience today.
That's wonderful. So we can be hopeful for the future in being able to more accurately determine these conditions and hopefully determine them early when I would assume they should be more treatable. We can get in front of the train. I feel like in so many cases, we're always chasing the train, and I've never caught a train in my life and don't think I will.
Well, this is, again, so very true. By many estimates, one of the proteins that builds up in the brain of people with Alzheimer's disease, amyloid protein, can now be detected 15 to 25 years before any clinical symptoms of memory loss begin. And so we can now do it. We're a few years away from a blood test that's quite accurate for Alzheimer's disease, which would be a true breakthrough. Parkinson's disease research is a bit behind that, but we are working hard on that. There's now a biopsy to help diagnose Parkinson's disease, a skin biopsy. So there have been important developments in recent years for diagnosis, at least.
Excellent, excellent. Can you share with us how music affects the brain and other organ systems and actually the body in general? I'm a very big fan of music. I've lost my singing voice. I actually have done some singing professionally, which nobody knows at Hopkins. You're the first I've ever told that to. Hey, like that. Now we've got tens of thousands of other women that are hearing this and now know that. So I know how much it provides to me a sense of peace and well-being. But I especially benefit when I'm able to sing the song myself. Whether you can tell us that it's better if you can do it yourself than listen to it is something that we'll also discuss this morning. But first, let's start with, how does it affect the brain? And other organ systems in our body, and frankly, just our body in general. We all know that expression, music soothes the savage beast. I'm a big fan of music and what it can do.
Broadly speaking, music simultaneously activates many areas of the brain, and some people have argued as many, if not more than any other human activity. And I'm just talking about listening to music here. Making music activates additional areas we could talk about in more depth. But one well-studied system that music clearly affects that I think most listeners can relate to is the hypothalamic pituitary adrenal axis. That's the HPA axis for short. And this is the hormonal system, of course, originating in the brain. As a neurologist, I am biased and think that everything originates in the brain and is controlled by the brain. But it's a system that regulates stress levels and the response to stress in the body. This system regulates the autonomic nervous system by affecting the parasympathetic autonomic nervous system, which is the rest and digest system. So imagine how you feel when you're relaxing after a nice lunch or dinner, versus the fight or flight system, which our ancestors had to activate very quickly when running away from a predator, saber-toothed tiger or something along those lines. So you've got the two sides of the coin, both parts of the autonomic nervous system, both of which can be powerfully activated by music. So I want to introduce the concept of one size does not fit all when it comes to music. Mozart, as much as I personally love Mozart's music, will not heal everyone. It's not a panacea. But what we need to do, and what we've started doing through the Johns Hopkins Center for Music and Medicine, is to work on developing precision music medicine, which is individualized, targeted music-based interventions for people living with neurodegenerative conditions and moving beyond neurology as well. So music, to give you a few more examples, can, in terms of the parasympathetic nervous system, if it's music considered relaxing, typically for most people, it's music that approximates one's resting heart rate, so around 50 to 60 beats per minute. Music that tends to be instrumental rather than having words, although again, one size does not fit all, and there are exceptions. That doesn't have too much in the way of pitch, frequency, variability, rhythmic changes, something that is really identified as calm by most people. And again, I want to make the point that from a cultural standpoint, if somebody is raised in a Western country like the US, then some types of classical music, some types of soft rock may be seen as relaxing, whereas somebody who's coming in from the Indian subcontinent could feel quite differently and might prefer music that they heard in their childhood. That's, again, to make the point that one size does not fit all. But based on many, many research studies over the last few decades, cortisol, the stress hormone, which is released in response to activation of the hypothalamic pituitary adrenal axis I mentioned, can be reduced in meaningful ways by listening to certain types of preferred relaxing music. And so activating this parasympathetic rest and digest part of the autonomic nervous system is definitely one way that music can help relax us and relieve stress. Other examples of how music impacts the brain and through it the rest of the body include the motor system. For instance, a musician, I didn't mention before, I play the violin. That's what I'd be doing professionally if I didn't go into medicine.
Wonderful.
Yes, thank you. As a musician, when I hear a piece, particularly a piece I'm familiar with, let's say something played on the violin, I have powerful activation in the parts of my brain that control the fingers of my left hand and the bow arm, which is the right arm. And so I don't actually need to be playing when hearing a song that I'm familiar with, especially something I played before, to activate the parts of my brain that normally are responsible for controlling voluntary motor function, voluntary actions, movements. And by the same token, as I'm playing, I need real-time feedback through my somatosensory cortex, which is just adjacent to the motor cortex, in order to make real-time, fine-grained adjustments so that the music I'm making is sounding the way I want it to sound. So I need feedback through my fingers to the brain on the amount of pressure on the string, on the precise position, so I could make minute adjustments. Other key areas activated are areas, or networks as we call it in neuroscience, networks in the brain that process emotion. Again, one size does not fit all. I'll give you a relatable example where imagine you're hearing a song that you danced to at your wedding, your main first song. This is, let's say, 15 years after the event occurred. It's quite memorable. I think everybody will agree. But somebody somebody who has a happy marriage 15 years in will have a very different pattern of activation in their brain than someone who heard the same exact song, who danced to the same exact song around the same time, and then 7, 8 years later went through a bitter divorce. So coming back to the idea of activating the fight or flight system, or in this case, the so-called pleasure center of the brain, the nucleus accumbens, the first example, you can have powerful release of the chemical dopamine in the brain network that processes positive, pleasurable emotion. Whereas somebody who had a bitter divorce and is hearing the same song will have a very different contextual response. They will have a release of chemicals in a different part of the brain, the amygdala, which regulates that fight or flight response and response of fear, of being threatened, very powerful negative emotion that could result from the same exact song exposure. So again, I want to drive home the point that one size does not fit all. There are multiple other networks that are simultaneously activated in the brain from just listening to music, and even more when we're making music, singing, or playing a musical instrument. And therein lies the promise of music-based interventions, where if you could appropriately tailor it, individually tailor it, then there might be something for just about anyone with any illness from music that music could do for them. But at the same time, from a scientific research perspective, it makes it challenging to study it and trying to isolate which network is being predominantly affected to bring about a particular behavioral response. So therein lies both the promise and the challenge of music.
Yes, and you're giving really good examples of how our memory is tied to certain songs. And of course, there's no way for a patient to be able to describe every single thing that's happened to them in their life. I always say we bring all of the baggage of our life and the gifts of our life to the next disease or disorder that we have, no matter what it is. But this is a really good example of how that connection to memory also plays a factor in listening to music and what impact it may have upon us. So you provided some examples of the power and benefit of music on the brain. And I'd like to talk a little bit more specifically about Alzheimer's disease and what positive influence that it can have. I'm a big Tony Bennett fan, and I did watch his last performance, his farewell performance, which was just as magnificent as it was 60 years ago, which was the first time I heard him sing. And yet we know that he is dealing with profound Alzheimer's disease, and yet he remembers every word of every song, which I found very moving. I actually cried through the whole thing on television. I tried to picture myself being one of the people in his orchestra and realizing the power they had in their hands of playing a song. And of course, most of his players have been with him forever. I was mesmerized by it. And I think Lady Gaga was as well. I think that she was just as thankful and mesmerized of the impact that music has provided him to continue on and to provide joy to so many people. And I also hope joy to himself, because he's a passionate singer.
Indeed, music can provide joy, grace, fulfillment, and dignity in some of the most difficult times. And the examples abound. Glenn Campbell is another example that comes to mind. There's an incredible documentary about him that can be found on YouTube. Another powerful film that I recommend people check out is Alive Inside. I've actually shared the trailer, the 2-minute trailer on YouTube for this film with patients and family members in the exam room as we complete the visit. And there's been some therapeutic crying in that context as well. So in terms of unraveling the mystery, firstly, the music can powerfully activate the memory network that is devastated early on in Alzheimer's disease. So that's one part of the puzzle. And I'll say right now that we have recently embarked upon a study at Johns Hopkins for people with amnestic, which is memory predominant cognitive impairment, and early, in other words, mild symptomatic Alzheimer's disease dementia. We try to capture people early because, as you said, Lillian, we think that earlier treatment might result in more gains. And so we are exposing people to 8 weeks of twice-a-week music therapy delivered to their home via Zoom by professional music therapists with at least 10 years of dementia care experience. And we are, of course, doing memory testing, other cognitive testing at baseline before the study begins, and are getting an MRI scan where we are evaluating the extent of network damage that they have at the time using both structural MRI and functional MRI when they're at rest and when they're doing a task. The task is where it gets, I think, I'm biased, where it gets interesting and neat. We first identify the top 10 songs that these patients prefer using a validated questionnaire. And then we take the very top song that they identify and scramble it beyond recognition in a very specific but repeatable way and replicable way that other researchers can do after us. And we're playing a snippet of the actual song that's recognizable in a recording that they themselves have selected. And then we're playing the same exact recording for the same exact duration, but scrambled beyond recognition. So controlling for the performer, obviously for the song, for volume changes, for pitch changes. And then we also, third task within the scanner, the MRI scanner, we are playing another song that the patients have not identified. And we're using Spotify to identify a well-matched song on multiple parameters that nevertheless doesn't have that emotional valence and connection for the patient. And so we are seeing what the differences are in network activation between the snippet of a personally preferred selected song, that same song scrambled beyond recognition, and then a song that has not been selected that doesn't have that emotional connection. And we're doing all of that in the MRI scanner at baseline, and then repeating the scan after 16 sessions of music therapy over 8 weeks. So we want to see if there are changes that we can measure. And I can tell you right now, a lot of listeners might be surprised to hear just 8 weeks. Is this something that's enough time to see measurable changes in the brain using this approach? The answer is yes, based on multiple studies, including several small pilot studies published just in the last year to 2 years by our colleagues from around the world. And so there's a precedent actually for looking at it that way. We at the Johns Hopkins Center for Music and Medicine seek to do it in a more rigorous way that meets Johns Hopkins research standards. So we're very excited about this study. We are looking to enroll ideally at least 30 patients with amnestic mild cognitive impairment or early mild dementia due to Alzheimer's disease over the coming year to 2 years. I hope to come back and perhaps report on the results of the study before too long.
Oh, that would be wonderful. And talk about giving hope. Holy schmoly. That's absolutely fantastic. Fantastic. Tell us also about the role of music in the medical treatment of Parkinson's disease.
Yes, well, this is very near and dear to my heart because I am actually a movement disorders neurologist. So my subspecialty within neurology is diseases that affect the voluntary movements of people. And the most common such disease is Parkinson's disease. So I see a lot of patients in my practice who have Parkinson's disease or other similar disorders, so-called cousins of Parkinson's disease. They're termed formally atypical Parkinsonian disorders. So that really is the focus of my clinical practice and my clinical research. And going back to the 1970s, there have been music and rhythm-based techniques that have been used for various symptoms of Parkinson's disease. The best studied such technique is called Rhythmic auditory stimulation, or RAS. And the idea is very simple. It's based on the fact that we know that people with Parkinson's disease struggle with rhythm processing. And the way that it's most obvious to the casual observer that it manifests is that their walking pattern becomes less rhythmic. It does not look normal. It breaks down. So people tend to have shorter steps. They tend to walk more slowly. There's often a leaning forward, so a postural change. And over time, the feet may begin to shuffle. A phenomenon called freezing of gait develops, unfortunately, where the feet just really get stuck to the ground as if they're glued. And that could happen when walking straight ahead or when turning around. And that phenomenon is really dangerous because if it's severe enough, it could lead someone to fall. And so one of the holy grails for me as a clinician treating people with Parkinson's disease and related disorders is trying to identify people at risk of falling and trying to prevent those falls, which can often be traumatic. So rhythmic auditory stimulation utilizes this concept of rhythmic entrainment in the brain. Here I'll give an understandable example. Imagine you're at a concert. Tony Bennett is a perfect example. Thousands of people are in the audience, and Tony wants to have the audience clap along with him. So he initiates, and people start clapping along. How long does it take for an audience of thousands to begin to clap along in perfect synchrony? It takes seconds. The idea behind that is rhythmic entrainment. And this has been demonstrated in healthy people who have agreed to be studied using electroencephalography, the scalp EEG with electrodes. And so what has been shown as the concept behind this rhythmic entrainment concept is that the brain, and through it the rest of the body, starts to react in rhythm, in time, to an external beat that someone hears. And this is actually not limited to human beings. This is observed in primates. This is observed in different animal systems. So it's not just us. But when it comes to humans, if somebody's hearing a beat, let's remove the melody from this for a second, just talk about pure tones, beats 1 per second, 1 hertz frequency. Within less than a minute, in a healthy brain, there is an EEG peak that we can actually measure that's exactly 1 hertz. That's the idea. And what's interesting is that this is a peak that's observed regardless of whether somebody is outwardly keeping time. When somebody's really in the groove, that's one way musicians sometimes describe, being in the groove in the moment. If you're not a musician, you could still be in the groove when you hear a melody that's got a really catchy rhythm, and you find yourself, maybe to your surprise, tapping along with your foot or with your hand. You're in the groove, you're rhythmically entrained. That's the idea. And so there's some experiments and folks that had them tap along to different beats. And at the same time, they had the EEG cap on, and they were looking at what was happening in the brain. So when you hear 1 hertz beat, 1 per second beats, people will tap along at 1 hertz. They will do a very good job. And their brain will follow along, because you could see a 1 hertz peak when averaging across the EEG spectrum for both sides of the brain, both hemispheres. When you go to 2 hertz, very quickly it switches to 2 hertz. So that's twice as fast, 2 per second. When you go to 5 hertz, 5 per second. And so you get the idea. Now,
Yes.
one interesting experiment, this is about 10 years ago now, that was done, is when you get really fast, where people can no longer keep up, even healthy people, let's say 10 times per second, super fast, you can't really sustain that. People stopped tapping along externally, but the brain still kept up. And even more interestingly, the brain generated a pattern of expectation that you could interpret the data as, where you had multiples of the frequency that was being heard that were generated as smaller but visible, observable, detectable peaks. So you had multiples of, let's say, 2.5 hertz, you had 2.5, 5 hertz, you had 10 hertz, and even so on up to about 100 hertz, you could still see the peaks in EEG even when people outwardly stopped following along. To me, that's an example of musical expectation, where people are rhythmically entrained, so they get a sense of, okay, this is where the next beat is going to fall. This is the concept behind rhythmic auditory stimulation, which has been shown since the 1970s to help normalize or make more rhythmic the gait in people with Parkinson's disease. And one exciting development, we just completed a pilot study that I'll mention together with Boston University, where we did what's called closed loop adaptive rhythmic auditory stimulation. People are listening to music playlists through headphones, and at the same time are wearing on each of their shoes a sensor that's linked to the phone that plays the playlist via Bluetooth. The sensor detects the gait speed and several other parameters, basically rhythmicity of walking in these patients with Parkinson's disease, and sends a signal to the playlist, which causes the song to slow down or speed up, in other words, adjust in tempo, and also get a metronome, that strong beat that musicians use to help when they practice, a metronome-like strong beat overlaid on top of the music, on top of the melody. And so the results are not yet published, but I'm happy to tell you that they're very promising when it comes to enabling people with Parkinson's disease to walk more rhythmically and, frankly, to walk more, because we know that one of the key things that we need to encourage all of our patients, whether it's Alzheimer's disease, Parkinson's disease, or other illnesses, to do is to move more, and particularly get at least a moderate level of aerobic exercise. So for the listeners, apart from the music, I will put in a plug for the goal of 150 minutes per week of moderate level aerobic exercise. And so one derivative measure of this, which we looked at in our pilot study for what we called MedRhythms, that's the company that provided the sensors and the device for this, is to enable people to walk more rhythmically and to walk more. And we were able to double people's amount of moderate intensity walking from baseline to the end of the 1 month pilot study. So we're very excited to move this forward into phase 3 multi-site trials in the coming year or so, we hope.
Isn't that fantastic? Now, I've also heard of something called Parkinsonics Choral Group. Can you tell us a little bit about that?
Oh, absolutely. Yes, this is near my heart because it was the first study that we completed under the umbrella, the auspices of the Center for Music and Medicine. And so there were already several studies Again, we didn't start from scratch, which is great. Already several studies suggesting that some aspects of singing together might help aspects of voice functioning in Parkinson's disease. We talked about walking in balance, but I should mention that communication in people with Parkinson's disease, especially as the disease progresses, is often affected by a monotone and lower volume voice. So particularly when wearing a mask, very relevant in the last 3 years or so, particularly when speaking over the phone, when somebody doesn't have the benefit of reading somebody's lips, people with Parkinson's disease often struggle because the voice drops down over the course of a long phrase or sentence. It's monotone. There's a loss of clarity of diction. And so for all those reasons, communication really is an important aspect of quality of life that's impaired in people with Parkinson's disease. So what we tried to do through the Parkinsonic study was to see if group singing once a week can actually improve objectively the voice volume, in other words, loudness measured in decibels in people who were singing. And so we recruited a group of 32 patients, randomly assigned them to start singing under the direction of a professional choir director, Leah Wanenchuk, well known to the Baltimore singing community. And half of the participants began to sing right away. The other half went into a social control group where it was basically a support group for people with Parkinson's disease. We thought that we need to carefully control for the pro-social aspects of music. Singing together, playing together in an orchestra in a group is very motivating for people in and of itself. The network that subserves motivation in the brain is powerfully activated by playing music, particularly playing music together. And so that's part of the answer. So we wanted to carefully control for that. And we thought a support group would be a wonderful way of doing that. And so half of the participants started to sing right away while others did the support group. And after 12 weeks of this, we crossed people over. So those in the support group began to sing, and those who were singing went into the support group. And we are actually, fast forward to now, awaiting the final proof of the accepted paper of this manuscript, the Parkinsonics study. But we found that there were objective voice loudness improvements when we looked at people reading a standard paragraph, the rainbow passage, and when we had people describe a standard picture from a neuropsychological battery called the cookie theft picture. So we had a professional decibel meter placed at exactly 50 centimeters away from the patient's mouth as they read this paragraph and described this picture. And we did baseline assessments, and then every 6 weeks for 30 weeks until the end of the study. So by 24 weeks, everybody was done with the intervention. And we wanted to look at the washout effect. So whether 6 weeks after the end of intervention, whether there were still sustained benefits. And I have to tell you, to our pleasant surprise, there were actually some sustained benefits, including in voice volume. We also saw some aspects of quality of life improvement, which was extremely important, as you know, for all of our patients, sometimes more so than any objective improvement. And even more surprising is that we actually had some signal towards improvement in motor function as assessed by the rating scale we use for Parkinson's disease, which was really surprising. And so we really dug in and tried to understand why would people who are sitting or standing, typically sitting during the rehearsals, would be better when it comes to the rapid alternating motor tasks, walking, things like that. And part of the answer, I think, is the method of training, because Leo had to teach the patients solfege and note singing from scratch. We made sure to have music naive or choir naive patients at baseline. And so he used various hand motions. That's one of the techniques that he uses in his practice to teach each note. So things like this. So hand positions were part of it. And the other part of it is that there was a 10 to 15 minute physical warm-up, sit down, stand up, sit down, stand up, stretching that was part of the choir-based practice, which again is standard for Leo's approach. And that, I think, actually made quite a bit of a difference for our patients. Now, I should say that the design of the study made it complicated for us to separate how much exactly of the improvements that we saw, which were so encouraging, was due to the singing itself versus a support group. Because what we realized a bit after the fact is that in a large room, because the rooms were actually the same size for the support group and the choir, and they were adjacent to each other, we controlled for location in the study, it required that patients really spoke up. If they wanted to speak up as part of the group, they really had to raise their voice and enunciate. So I think there was some benefit they gained through that, which frankly makes me happy, because that means we had a good control group. So the findings are promising. And the most important thing I'll tell you is that before the study was over, most of the participants came to us and said, we're really enjoying ourselves. We would like to continue this. And so our center has been sponsoring ever since 2016. When the study finished, we've been sponsoring the Parkinsonics choral singing group, which is now open to patients with all Parkinsonian disorders, not just Parkinson's disease, as well as their care partners. It's been on Zoom weekly on Wednesday afternoons since May 2020, and we are in in-depth discussions with the leadership of the group to hopefully get back to in-person singing at Govans Presbyterian Church in the city of Baltimore. This is a great example of our blueprint for other studies that we've done and other community-based programs where, of course, seek to recruit participants from the greater Baltimore community for our studies, as always. But we want to give back to the community by subsidizing or really sponsoring free community-based groups. So now we have the Guitar PD group through our wonderful School of Music, Peabody, which is a subsidized class for people with Parkinson's disease to take guitar lessons based on our Guitar PD that is now published earlier this year. And we have a Drum PD or PD Drummers program that has been virtual since last year. And we're adding an in-person class as well for people with Parkinson's disease and their care partners at Govans Presbyterian Church. And I'll just mention quickly that we're also developing music therapy support groups. We've started that virtually speaking this year, and we started with Parkinsonism and are now expanding to patients suffering from ataxias. And hopefully later this year, we'll be starting a group for people with Huntington disease.
Do you anticipate also going into Down syndrome and perhaps even autism?
Fantastic question. So when it comes to autism, we have explored this early on. I mentioned the pro-social nature of music. People know that in the autism spectrum, social interaction is often one of the challenges for both kids and adults living with ASD. And so music, and this is in multiple published studies, has a role to play when it comes to improving some aspects of behavior. We're very interested in working on that. We've had some conversations with the Kennedy Krieger Rehabilitation Institute, and that's something that we'd like to pursue going forward. I will tell you that early on, when I connected with Kennedy Krieger a few years back, they said, well, we already have multiple music therapists on staff clinically delivering music therapy to individuals and groups on the autism spectrum. So that is already something that's being done. Whether you want to build on that through a large research study, that of course requires a grant, and that's a separate discussion. Coming back to the point about Down syndrome, there's an important link people often don't realize between Down syndrome and Alzheimer's disease dementia. The problem with Down syndrome is trisomy 21. So the 21st chromosome is in triplicate instead of the normal duplicate. And that happens to be the chromosome on which the amyloid precursor protein is coded. And so it's not coincidental. Too much amyloid is being made, and people with Down syndrome, by the time they reach their 40s, often develop symptoms of dementia due to Alzheimer's disease. And this has been well understood and studied. And my personal connection to music as medicine actually comes through this. My mom told me that she had a grand rounds in medical school when she attended. She's also a neurologist practicing in Philadelphia, by the way. In her medical school, they gave a grand rounds of a patient who was suffering from dementia due to Alzheimer's disease in his 40s. And he had Down syndrome, underlying Down syndrome. But he had a lovely voice, and he learned several opera arias when he was younger in Italian, not his first language, and retained the ability to sing those arias perfectly. It was about 4 arias or so. And this was presented at Grand Rounds, where he essentially lost the ability to speak his native language, but retained the ability to sing those arias in a foreign language beautifully. What's the explanation for this? Well, without going too much into the woods, what happens over time to memory is that it tends to be more and more distributed towards the outer parts, so cortex of the brain, away from those deeper memory network areas that are devastated by Alzheimer's disease. So we call that overlearned information. And so when something with music becomes overlearned, or another activity, for example, dance movements in the professional dancer, suffers from Alzheimer's disease and is no longer able to describe using words what the dance is. She can actually show you. Again, these are overlearned patterns. But music is special in the sense that it activates these additional emotional networks. It brings back and helps activate autobiographical memory. That's the basis of our study in Alzheimer's disease that I mentioned earlier, where we are seeking to powerfully activate autobiographical memories and see if using music can help unlock other memories that are extra musical, that don't to music itself. And so there's definitely a lot of promise, and people with Down syndrome who, as they get older, at higher risk of suffering from Alzheimer's disease dementia, can certainly, in my biased opinion, benefit from music-based interventions, music therapy from a licensed professional therapist specifically.
I have the advantage of being with you today and seeing the expressions on your face and the enthusiasm, and our listeners can hear the enthusiasm in your voice. But I want to tell all of the listeners that I've been at Hopkins almost 40 years, and you were one of the most passionate physicians about the field of work that he is in. And it's a privilege for me to be with you today. And I consider it a privilege for our audience to get to listen to you. I also was thinking if there's on Jeopardy, if any of the, particularly the ladies out there, we have mostly girls listening to this podcast and a few men, but mostly girls. I think about if we had Jeopardy and they had a column on neurodegenerative disorders and music, you've given them all the answers so they could win Jeopardy. That would be absolutely fantastic.
So happy to hear that.
I certainly do think so. I wanted to share with you a personal story for me about music. I am a 2-time breast cancer survivor. I'm 30 years out from my original diagnoses, and both times I needed to have mastectomies. I was not a candidate for lumpectomy, and I also was not a candidate for reconstruction, which was disappointing, but I powered through with my breast prostheses, Betty Boop and Bobby Sue. And 10 years after my second mastectomy, I then was medically cleared to be able to finally do reconstruction. And I wasn't sure whether or not I should do it. Ironically, there was no Lillie Shockney to talk to Lillie Shockney in the breast center because I'm a strong advocate for reconstruction. I sit down and tell patients you were born with 2 breasts, you can still have 2 breasts, but there wasn't anybody for me to ask about this. So I, of course, asked my husband, and he said, well, if you do it for you. Don't do it for me. And I wasn't used to doing things for myself, so that wasn't any help. My daughter was worried that maybe something medically would go wrong because I'd been in the ICU 4 prior times in an unplanned way. So she wasn't real keen on this either. So I decided to go to church on a Friday evening, went by myself. Church was empty, sat on the back pew, and I said out loud, God, you give me a sign if it's okay with you that I do breast reconstruction. And if you never give me a sign, that's fine, because Betty Boo, Bobby Sue, myself, and my husband, we're all doing fine. And I thought, I'm never going to tell anybody that I've gone to church and done this. As I'm leaving the church, I didn't think I would be hit by a bolt of lightning or see a burning bush or something. I just walked on down to my car and I opened the door and got in, turned the ignition key on, and my radio was on. The radio was playing, and the song that came on the radio that I had not heard for 20 years was Sexual Healing by Marvin Gaye.
Wow.
And the first full verse that I heard was, I can't wait for you to operate. I'm your medicine, let me in.
You're kidding.
I got home and I said to my husband, God just sang Sexual Healing to me on my car radio. I'm going to have the reconstruction done.
That's unbelievable.
Yes. And so I had what's called deep flap reconstruction, autologous tissue transfer, my tummy fat cut free from my body and transplanted up to my chest with microvascular surgery. And I wore headphones as I was being put to sleep, listening to Marvin Gaye singing that song to me. So another way in which I got an answer to a challenging question. And I will never forget that evening at church, and certainly will not forget the day that my silhouette got to be restored to me. So I want to thank you so much for joining me today and to learn about the powerful interface that music can have with medicine and vice versa. So Alex, thank you so much. And if you out there listening would like an opportunity to ask him questions on this topic, I encourage you to register for a Woman's Journey program in Baltimore on Saturday, October 29th, where he will be one of our 3 Johns Hopkins medicine experts presenting. Enjoy a heart-healthy brunch and hear a woman's journey from a COVID-19 survivor who triumphed over dramatic challenges to help others. 3 compelling presentations about health and well-being will enlighten you about a promising intervention for memory loss, symptoms we shouldn't ignore, and a new test to diagnose cancers, and inform us also about vitamins and supplements. And during morning rounds, you can talk with Johns Hopkins specialists about diverse issues. For those of you who cannot make it to Baltimore, you can actually register and attend virtually with us. So for more information about this and the other A Woman's Journey programs, please visit hopkinsmedicine.org/A Woman's Journey. We hope you will join us next month for another educational and informative podcast featuring another Johns Hopkins medicine expert. And again, Alex, thank you.
Thank you so much for having me. As I see the light streaming through your window, really, it's just been an inspiring conversation. So thank you again.
Thank you.
Thank you for listening to A Woman's Journey podcast. Join me, Kelly Gear-Ripken, your host, Lillie Shockney, and a variety of Johns Hopkins experts on the first Thursday of each month to learn about medical advances in women's health. A Woman's Journey is grateful for the unrestricted educational grants from HRH Foundation that supports our podcast series, Insights That Matter. For more information about A Woman's Journey's virtual programs occurring throughout the year and our monthly webcasts and podcasts, visit our website, hopkinsmedicine.org/A Woman's Journey. Like us on Facebook and Twitter, and visit our website at hopkinsmedicine.org/A Woman's Journey. Until next time, stay well.